So a nurse relationship manager essentially handles all of the aspects of recruiting for taking care of a nurse who is active with the nursing company. Um, the big benefit of our position, at least from my perspective, is that we get to work with nurses who are already working with us, and we don't have to spend time looking for new ones. So we get to spend all of our time dedicated to the satisfaction of the people we already work with.
True. And even like in the name, like nurse relationship manager, I feel like our main priority is just to make sure that the nurses are heard, right?
Yeah,
I would say, right?
definitely.
I like to think of our position as like middleman. Like we have like HR, right? You have like that resource person. I feel like that's like our role. Like anything the nurse needs, like when it comes to like payroll or anything, like even a situation that's going on at the facility, I feel like we listen and
Very
we try to
much so.
help. Yeah.
Yeah, no, and I think in a lot of ways uh, we get to be more advocates for our nurses than anything else. Um, and it is like you said, it's a middleman thing where you you have to you're looking out for the best interests of a person, but you have to balance the needs of other people while you're doing that, and sort of make sure that everybody gets what they need.
Yeah, I would agree. Whew. Our day to day. Wow. I actually thought about that because I get asked that a lot. Every day is so different.
Mhm.
I feel like you could be doing something, maybe like a payroll, something happened with like someone's time card, and then like you get a call, and a nurse is like, "Oh my gosh, like this is what happened to me today." Just like talk, and you're
Yeah.
like, "Okay, stop what I'm doing," which is totally fine. But just listening to them, I feel like is I don't know.
Yeah,
Yeah, I feel like it's a lot of that. It's a lot of like
I would say I would say
drama-free
it's
situations.
even minute to minute
Yeah,
in terms of what we do,
yeah,
sort of changing rapidly, and it's a combination of, like we said, working with our nurses to try to get new contracts and making sure that the facility is happy with what we want from them and vice versa. It's also, like you said, just kind of listening to venting on a rough day,
hmm
or making sure that everybody gets paid on time, or looking for new jobs just so you can feel a little bit better this week because things are
yeah,
rough this week.
right, right.
Um, right down to really special things. Like sometimes, a couple of months ago, I had the opportunity to help out a nurse with a GoFundMe who had lost her home in a disaster, and it was a real pleasure to just be able to do something nice for somebody like that as a part of my work.
Yeah,
I think the biggest thing that makes us different from recruiters is, like I had said before, that we're not sourcing new nurses. We're not trying to fill new jobs. We're working with the people who already work with us and making sure that they stay happy, that they stay working, and that they get everything that they need.
exactly. Being the voice for them, for
Yeah.
sure. Yeah, and it's also I feel more personable. I can pull up like every nurse I have and tell you their whole life story. But yeah, I agree. It's a little bit different. We're not exactly like outsourcing or looking to find like new nurses. We're managing that relationship with our current nurses, and I think that's what a lot of our nurses appreciate too. It's not just like another agency where they're like it's kind of like a transactional
Mm.
um, relationship. It's more so like, wow, this person actually cares for me and genuinely like wants the best like interest for me.
Yeah, and
Yeah,
not that a recruiter doesn't have that,
of
but that
course.
their time is stretched thinner than ours, and ours
Right.
is allowed to be a little bit more focused on just making sure that our nurses are happy and that they stay that way.
Yeah, I agree. Honestly, I love like when my nurses tell me what's going on in their personal life, between like having a baby or they just bought a house or they're going on vacation. One of my nurses, I was on vacation personally, and I texted her and was like, when she reached out to me, she's like, "Oh, I'm in the Bahamas right now." I'm like, "You're in the Bahamas. I'm in the Bahamas. Like, where are you?" And we were in the hotel next to each other.
That's
Yeah, it
crazy.
was so wild.
That's
But
awesome.
like little things like that, like I feel like it's personable. I feel like it's like a friendship, and
Yeah.
I just love the relationship I have with my nurses.
Yeah, no,
Yeah, it's like
I feel the same
authentic.
way.
Mhm.
I like when they spill the tea.
Yeah,
I like to sit on
the
the
tea.
phone. Yeah,
Yeah,
I like to sit on the phone and listen to um, who doesn't have their head on straight,
yeah,
and who needs to fix their management style,
yeah,
and just kind of release that energy. I think I get some venting, some sort of venting release when just from hearing a nurse vent.
Yeah.
Sometimes.
And sometimes I'll like find myself like getting mad for them. Like I'm like, what do you mean this happened to you? You know? Or what do you mean this person said this
Oh
to you?
no, not Mama's house. Hold on, girl.
Yeah. I was like, wait, hold on. I need to go to another room. Tell me what happened, start to finish. Yeah. Yeah. It's entertaining sometimes for sure.